So, classification of mental disorder. So we'll be covering the definition of classification, and we'll be talking about the advantages of classification, the key terms, and then the definition of health, approaches of classification, systems of classification, DSM, and a little bit in detail about ICD and then reference. Now, what are the advantages of classification? Organization of disorders into diagnostic classes to allow mental health practitioners and researchers to communicate more effectively with each other, to arrive at a diagnosis that has important predictive power, to distinguish between one diagnosis from another, structure for teaching phenomenology and differential diagnosis, and psychoeducation of the parents and their families. Diagnostic classifications. The listing of diagnoses grouped by relatedness. That is what you do in the diagnostic classifications. Diagnostic criteria, the rules that need to be followed for making a diagnosis. Now, systems of classification in psychiatry. हमारे पास, we have a lot of them, but these four are the major ones. ICD by WHO, DSM by the American Psychiatric Association, Chinese classification of mental disorders, Latin American guide for psychiatric diagnosis. Now they are divided into subsections. Now DSM-5 is divided into further 3 sections. Section 1 में we cover the DSM-5 basics. Section 2 diagnostic criteria and codes, and section 3 is for the emerging measures and models and has the appendix. Now the key chains in DSM-5. DSM-5, as it is clear from the number, it was never the first one. So 1 आया, फिर 2, then 3, then 4, 4 TR and then 5. So DSM-5, इसमें what is different than the other ones is the deletion of multi-axial system. So there is no multi-axial system at present as far as DSM-5 is concerned. The structure and grouping of disorders. The removal of PTSD and acute stress disorders from the anxiety disorder category in the DSM-4 and their placement in a new chapter called trauma and stress related disorders. Obsessive compulsive disorders was also moved out of the anxiety disorder chapter and also placed in a new chapter called obsessive compulsive and related disorders. This group also includes the body dysmorphic disorder, wherein the patient thinks that some part of their body is not in symmetry. And then there is trichotillomania, where the patient starts pulling their hair. So they have this tendency of pulling their hair without any reason. And there is a new disorder diagnosis which is known as hoarding disorder as well as skin picking disorder. So in hoarding disorder, the patient has the tendency of hoarding stuff. Either they'll start hoarding their old objects, the ones which are not in utility, वो उन चीजों को भी अपने पास रखना शुरू कर देते हैं. And then skin picking में, where the patient tends to pick the skin. There's no reason for that. They don't have any skin disorder. They don't have itching. They don't have any bugs also. Yet they feel like picking their skin. So they are also placed in the obsessive compulsive disorder wala category. Now coming to the ICD, which is the most used by us in India. So here represents the International Statistical Classification of Diseases and Related Health Problems. So it can be defined as a system of categories to which morbid entities are assigned according to the established criteria. and used to translate the diagnosis of diseases from words into an alphanumeric code. So subsequently, when I go through the slides and show you the basic categories, you'll see कि हर category को they have given a numeric code along with an alpha code. So for us psychiatry, हमारे लिए F is the code. So F, and there is this numeric number against F. So उससे we come to know कि what is the diagnosis. So that's almost like a coding system. Now evolution of ICD. At present, the one that we use is ICD-10. The one which is upcoming is ICD-11. उसका manuscript ही है. It is not published as such. So, but all जैसे DSM का था, it came to 5 from 1. It started from 1 and came to 5. Same is with ICD. So it was in the year of 1855, William Farr, first medical statistician of General Register Office of England and Wales, submitted his report on nomenclature and statistical classification of diseases. In 1893, Bertillon classification of causes of death, introduced by the French physician Jacques Bertillon. And in 1900, an international conference revised what was then called the International Classification of Causes of Death and agreed to hold revisions of the system every 10 years. In 1948, the recently created WHO, an agency of United Nations, assumed responsibility for the ICD. In 1949, the sixth revision, published involved significant changes, included morbidity in addition to the mortality. Title was changed to International Statistical Classification of Diseases, Injuries and Causes of Death. It included a section on mental disorders. In 1965, the 8th edition was published, and in 1975, the 9th revision, well-known convention of using a dagger for marking an underlying disease and an asterisk to mark its manifestations, was issued in this revision. However, the most important single event for classification in psychiatry was inclusion of glossary and brief descriptions of the categories included in the 5th chapter, a procedure that was not the part of the other chapters. In 1989, the 10th revision was published, and in 1990, the ICD-10 was endorsed by the 43rd World Health Assembly and came to use in WHO member states as from 1994. And in 2000, India adopted this classification. So now talking about the ICD-10, it is much larger than ICD-9. ICD-10 has 21 chapters against 17 chapters that were present in ICD-9. And the numeric code, which was earlier just the numeric code for the ICD-9, and now it has been replaced by alphanumeric code, wherein you have the alphabet and then the numeric code, has been adopted for ICD-10. It enlarged the number of categories available for the classification. So basically, why the alphanumeric code? Because the numbers, there's limited numbers that you can use. So in order to elaborate or enlarge the whole sample, so the alphabet was also added in front of the numeric code. Now volumes of ICD. So there are 3 volumes. The volume 1 has the main classifications. The volume 2 has the instructions, the guidance to the users, and the volume 3 has alphabetical index. Now the multi-axial system, which is something which is not present in the DSM-5 at present, but it is present in ICD-10, is axis 1. So axis 1 mein you have the clinical syndromes like the psychiatric disorders. In our case, we'll be talking about the psychiatric disorders. So axis 1 has the psychiatric disorders. Just axis 2 hai, it has the disabilities. Now if the patient comes to us with a psychiatric disorder, we diagnose the patient with a psychiatric disorder, so we'll put that in the axis 1, the diagnosis. Then in the axis 2, we'll be keeping the disabilities if the patient comes with some disabilities. And then axis 3 will be the environmental or the circumstantial personal lifestyle or life management factors. And axis 3 mein we'll be considering their environment, the kind of situation and the surroundings the patient lives in. So that is what we'll be considering in the axis 3. Now this is the ICD-10 and this is the classification of mental disorders. So mental disorders as per the ICD-10 are classified as such. तो हमारे पास ये ग्रुप्स हैं. So F01 से लेके F09 तक we have the mental disorders which are due to physiological conditions. Now there is a lot of times that patient presents with a psychiatric picture. The patient will present to us with clinical features that are very much correlating to a psychiatric diagnosis. But when we do their workup, detailed workup, so we realize that the features are not because of the psychiatric illness, but they are because of some underlying organic cause. So those disorders are covered under the F01 to F09 wala classification. Then we have F10 to F19. Now in this F10 to 19, we have the mental and the behavioral disorders due to psychoactive substance use. Now in psychiatry, substance use is also very important because a lot of times it is the substance that is creating this whole havoc, wherein the patient comes to us with a very resembling picture to some psychiatric illness. जो उनकी picture होगी, clinical features जो होंगे, we'll think about some psychiatric illness. But then thereafter, after doing a detailed workup and taking their history, we realize that it is the substance. जो वो ले रहे हैं, the drugs that they're taking or the substance that they're taking, it is because of that substance कि वो picture उनकी एक psychiatric illness वाली बनी है. So all those, the potential substance which can lead to a psychiatric illness, they are covered under the F10 to F19 class. Then we have F20 to F29. So this is very interesting because whenever somebody talks about psychiatry, the first picture that comes to anyone's mind is a psychotic patient. So सब लोग हमेशा सबके दिमाग में एक बहुत fascinating picture आती है एक psychotic patient की, and this block covers those. So F20 से F29 में we have the disorders which are related to schizophrenia and the other psychotic disorders. Then talking about the F30 to F39, we have the mood disorders or the affective disorders. And then from F40 to 48, we have the anxiety, the dissociative, stress-related, somatoform, and other non-psychotic mental disorders. And from F50 to 59, we have the behavioral syndromes, which are associated with physiological disturbances and physical factors. And F60 to 69, there are disorders of adult personality and behavior. This is also a very interesting section. And then we have F70 to 79, which has intellectual disabilities. And F80 to 89, we have pervasive and specific developmental disabilities. And F90 to 98, there is behavioral and emotional disorders with onset usually occurring in the childhood or adolescence. And F99, it is unspecified mental disorder. When the picture cannot fit into any of these categories, so we go for F99. Now, starting with the F00 to F09. So you have the organic, including the symptomatic mental disorders. So first is dementia and Alzheimer's disease. So F00 is dementia in Alzheimer's. Then we have F01, which is vascular dementia. And then F02, which is dementia and other diseases classified elsewhere. And then you have F03, which is unspecified dementia. So ये तो हो गया हमारा dementia का block. Then coming to F04, which is organic amnestic syndrome not induced by alcohol and other psychoactive substance. So there is some, because we know alcohol is a major cause of amnesia. People drink and the other day they don't remember what they said in the intoxication state. So alcohol ho gaya, some other psychoactive substances, they are known to be notorious in this way that they lead to amnesia. The patient doesn't remember anything. So if we exclude alcohol and psychoactive substance and yet we don't have a psychiatric illness as such, so that thing will fall under this category. And then we have F05, which is delirium, which is not induced by alcohol and other psychoactive substance. Same, delirium. Delirium is also something which is more usually caused by a psychoactive substance. So agar history mein we are able to exclude the substance intake, so this is where the where the diagnosis will fall. And then we have F06, which is other mental disorders, which are due to brain damage and dysfunction and to physical disease. And F07 is personality and behavioral changes due to brain damage and dysfunction. A lot of time patients come with a history of RTA, road traffic accident, and patients, unke informants will say that the patient was absolutely fine before, but after meeting with the accident and after coming out of coma, 6-7 महीनों बाद, when the patient came out of coma, the patient has almost become a different person. They've become more aggressive, they have lost their memory, they're not able to remember us, they're talking irrelevant. So those patients will fall under this category. And then we have F09, which is unspecified organic or symptomatic mental disorders. So अगर नहीं पता चल रहा what is the cause of organic illness, then that will fall under F09. Then coming to the F10 to F19, they are the mental and the behavioral disorders which are due to psychoactive substance use. So the first one is alcohol. F10 is for alcohol and F11 is for opioids. F12 is for cannabinoids and F13 is for sedatives and hypnotics. And F14 is for cocaine. F15 is for stimulants, including caffeine. तो कैफीन को भी हम इंक्लूड करते हैं इसमें. And F16 is hallucinogens and F17 is tobacco. F18 is volatile solvents and F19 is due to multiple drug use. Sometimes the patient will come to you and they'll come and say, they'll give you history that I'm doing this drug also, that drug also, this also, this also. So there, instead of being confused ki where are we supposed to put this patient, we directly put that patient under the category of F19. Now, इसमें जो F10 है, जो F10 to F19 है, उसमें furthermore भी classified है वो. Like 4 and 5 categories may be used to specify the clinical condition. Because when a patient comes to you with a psychiatric illness which is due to the substance use, so patient will come to you with these pictures. पहला होगा acute intoxication, wherein the patient has taken the drug, तो acute intoxication state में आएगा. It is a very transient thing. It weans off. जैसे जैसे intoxication हटेगी, patient के symptoms भी हट जाएंगे. Then comes the harmful use. Harmful use is where the patient has been consuming a specific drug throughout their life. But now one fine day he decides कि मैं ज़्यादा dose ले लेता हूँ. So उस दिन जिस दिन उसने ज़्यादा dose ले ली, that will lead to the harmful use. Then we'll put that patient under that category. Dependence syndrome. Dependence syndrome, we have 6 ways of specifying dependence. और अगर वो 6 criterias में से 3 भी अगर वो specify कर पा रहा है over a period of 1 year, then we say the patient is dependent on certain drug. And then we'll put that patient under this category. Then is the withdrawal state. Withdrawal state is something that happens after the intoxication mostly. और उसमें क्या होगा, patient will give you very specific symptoms. Every drug, every substance has some very specific symptoms of withdrawal. So from those withdrawal symptoms, we are able to judge which substance he might have taken. And withdrawal state with delirium. Now delirium is a state in which the patient he has altered sensorium. He doesn't know where he is. His orientation will be impaired. He will be talking irrelevant. He'll be aggressive. वो भाग रहा होगा. So this is what is going to happen in withdrawal state with delirium. And then we have psychotic disorder, wherein the patient will start showing you features of psychosis. यहाँ पे confusion हो जाएगा कि maybe we'll start considering the patient as psychotic. But then on taking further history, we'll realize that, oh, it is because of the substance use that the patient has these psychotic features. As such, the patient is not psychotic. And then we have amnestic syndrome. Amnestic syndrome mein wahi, like I told you before, that alcohol specifically and the other drugs are more notorious in this way that they lead to amnesia. The patient won't remember. And residual and late onset of psychotic disorder and the other mental and behavioral disorders. Then we have F20 to F29, which has schizophrenia, schizotypal and delusional disorders. So F20 mein we have schizophrenia, which is something that everyone almost knows, and this is one of the most fascinating cases in psychiatry basically. So schizophrenia mein further we have subcategories, like these are the types of schizophrenia. So paranoid schizophrenia, hebephrenic schizophrenia, catatonic schizophrenia, undifferentiated, post-schizophrenic depression, residual, simple and other, and then finally schizophrenia unspecified. अगर वो कहीं भी नहीं fit हो रहा, then it goes there. Then F21 is schizotypal disorder, F22 is persistent delusional disorder, F23 is acute and transient psychotic disorders, F24 is induced delusional disorder, F25 is schizoaffective disorder, F28 is other non-organic psychotic disorders, and F29 is unspecified non-organic psychosis. Now coming to F30 and 39, the mood disorders. So in this mood disorders, we have maniac episode. Maniac episode, it is something which is associated wherein, as We'll also see, you will see it in the ward. These patients never sit. They never sit at a place. They're very restless. They're very talkative. They're very over familiar. ये जाके हर एक से ही दोस्ती कर लेंगे. Everyone becomes their relative at certain point of time, and they are this very typical feature of mania. And then we have bipolar affective. Bipolar affective mein we have both. The patient will come to you with the history wherein they'll have both the depressive episode followed by the maniac episode, and then again the depressive episode and the maniac episode. So it keeps on happening like this. That is why it is bipolar. कि दोनों poles touch करता है patient. Dip आता है, depression में जाता है, बहुत ऊपर जाता है तो mania आता है. And then we have the depressive disorder, recurrent depressive disorder, persistent mood disorders, and other mood disorders, and unspecified mood disorders. Now, coming to the F40 to 48, these are the neurotic, stress-related, and somatoform disorders. Now, neurotic is something wherein the patient has the insight, the patient understands their disease, they understand what is happening to them. So this is what is neurotic disorders. So we have the phobic anxiety disorders, other anxiety disorders. Anxiety disorders are quite common, especially amongst the student population because of exam anxiety, the competition and all. तो phobic में क्या होता है? They'll have very specific phobias. हर एक के होते हैं. किसी को पानी से डर लगता है, किसी को ऊंचाई से. So if you put them in that situation wherein that triggers their phobia, so they'll have anxiety. Another anxiety, obsessive compulsive disorder, OCD, reaction to severe stress and adjustment disorders, dissociative conversion disorders, somatoform disorders, and other neurotic disorders. Now, behavioral syndromes which are associated with physiological disturbances and physical factors. So now this is a very interesting group of the diagnosis. So we have F50 mein we have eating disorders. Eating disorder is also very common amongst the teenage and the young adult population. So, and then we have the non-organic sleep disorders. That is also very common amongst the young population. Sexual dysfunction, which is not caused by the organic disorder or disease. Mental and behavioral changes which are associated with purpurium, which are not elsewhere classified. Psychological and behavioral factors which are associated with disorders of disease classified elsewhere. Abuse of non-dependence producing substance, and then we have unspecified behavioral syndromes which are associated with physiological disturbance and physical factors. अब ये जो F55 है, how is it different from F10 to F19 वाली classification? It is because here the patient will be dependent. He or she will be consuming some substance, but that won't be the substance that causes dependence. Like people have this tendency of taking laxatives, people have this tendency of taking PPIs. Pantoprazole हो गया, फिर ranitidine हो गया, बहुत commonly लोग खाते हैं, which is not something which is going to create dependence basically, but the patients have this habit of eating it. So वो वाले patients इस category में आएंगे. Then we have F60 to 69. Now, disorders of adult personality and behavior. Now, this is a very interesting group of classification. F60 में होता है specific personality disorders है कि बहुत specific traits तुम्हें दिखेंगे इनकी personality के cluster A, B, C, and then you're able to diagnose them. So पहला उसमें आता है paranoid personality disorder, then we have schizoid personality disorder, we have dissocial personality disorder, emotionally unstable personality disorder. फिर उसके बाद आता है impulsive type. Now these patients will have this impulse. उनके हर actions बहुत impulsive होंगे. And then we have the borderline type. And then उसके बाद आता है F60 to 40, which is histrionic personality. Then we have anarchistic personality, anxious, which is avoidant personality disorders, dependent personality disorders, and other specific personality disorders. F60.9 is personality disorders unspecified. And then we have mixed in the other personalities, wherein you have some of the features from either of the groups. And then enduring personality changes not attributable to brain damage and disease. And habit and impulse disorders, gender identity disorders, and disorders of sexual preference. ये भी इन्हीं में आते हैं, adult personality and behavior में. Now, talking about the F70 to 79, here it is about the mental retardation. But now this term is obsolete. No one uses this term. Now we call this intellectual deficit. हम इसको intellectual deficit बोलते हैं, ना कि mental retardation. So you have F70 is mild, F71 is moderate, F72 is severe, then you have profound, other mental retardation, and F79 is unspecified. F80 to F89 are the disorders of psychological development. अब ये आते हैं, now we come to, अब हम adults से बच्चों में आए हैं. Now we coming to the children. Whenever there is issues with development of a child, so those disorders will be specified here. So specific developmental disorder of speech and language. Here the children have specific issue with their speech and language. बाकी सब ठीक होगा, but their speech and language will be impaired. Then you have scholastic skills. Then you have motor functions, mixed specific developmental disorders, pervasive developmental disorders, other disorders of psychological development, unspecified disorders of psychological development. F90 to 98, they are the behavioral and emotional disorders with onset usually occurring in childhood and adolescence. So you have hyperkinetic disorders. Hyperkinetic में the first thing that किसी के भी दिमाग में आता है, especially when you talk about child disorder psychiatry, the first diagnosis that comes to our mind is ADHD. So conduct disorders and mixed disorders of conduct and emotion, emotional disorders with onset specific to childhood, disorders of social functioning with onset specific to childhood and adolescence, tic disorders, other behavioral and emotional disorders with onset usually occurring in childhood and adolescence, and unspecified mental disorders. Now this was all about the ICD-10. Now talking about ICD-11, बहुत छोटा सा ही discussion है, because as such at present we are using ICD-10 only. So they are included now in ICD-11, the upcoming one. There are 7 chapters. The major reason why, the major reasons for reviewing, why the ICD-10 was actually reviewed, because बहुत elaborate है in itself the ICD-10. So the reasons were, एक तो था to improve the consistency and uniformity of the diagnostic information provided by the clinical descriptions. Then was to adapt new demands from the users and conditions of use. The environmental components and the context in which the classification is used has undergone profound changes with the passage of time. Definition of mental disorders will not change for the ICD-11. It still continues to remain the same. The major changes in the definition of mental disorders are not expected in ICD-11, and therefore the ICD-10 definitions will be maintained. A clinically recognizable set of symptoms or behaviors associated in most cases with distress and with interference with personal function. And while the emphasis will be on categories, the ICD-11 may also consider dimensions, at least in a few situations where simple measurements may be feasible. And these are the disorders that are now included in the ICD-11. So you have neurodevelopmental disorders, schizophrenia and other primary psychotic disorders, mood disorders in which you have anxiety and fear related disorders. इन्होंने एक ही जगह club कर दिए. Obsessive compulsive and related disorders have been removed from the anxiety cluster and they have been kept different. And disorders which are specifically associated with stress. Dissociative disorders also have a new classification. Then bodily distress disorder, feeding and eating disorders, elimination disorders, disorders due to substance use, impulse control disorders, disruptive behavior and dissocial disorders, personality disorders, paraphilic disorders, factitious disorders, neurocognitive disorders, mental and behavioral disorders which are associated with disorders or diseases classified elsewhere. This is the basic difference between ICD and DSM. It is of the United States, whereas it is about the official world classification. It focuses on the psychiatrists and the psychologists, whereas ICD it is designed to be used by and useful for different other health professionals also. Developed to fulfill the particular information needs of the US health system, whereas ICD it caters to the world and the global health system. And it is the property of APA, which is American Psychiatric Association. It is free charge and open access. ICD-10 anyone can use. It has the operational criteria, it has clinical descriptions. US में use होता है, it is multilingual है, वो English में ही है. Advantages for research, the DSM has advantages there. And for clinical use, ICD has an upper hand. And different formats, one version में, here you have multiple versions and formats and multiple users. Thank you.